Sharon. She's Ginevra. We both have professional and personal expertise in fibromyalgia. Today, we are welcoming our first guest who is taking a break from her very busy schedule to discuss her research, her virtual care clinic, and top strategies she uses to help her patients with fibromyalgia. She's a compassionate doctor who thrives on challenges, or like she likes to call it, journeys. And we are thrilled she is passionate about making a difference in fibromyalgia medicine.
A little bit more on Dr. Andrea Chadwick. First of all, I'm a huge fangirl of hers. She is amazing. She is also the medical director of Swing Care, a specialty clinic dedicated exclusively to fibromyalgia, is double board certified in anesthesiology and pain medicine. Her clinical expertise focuses on complex centralized pain syndromes, including fibromyalgia. And she is the director of the Fibromyalgia and Centralized Pain Exploration Lab at the University of Kansas Medical Center.
Thank you so much for being here today. It's a delight to chat with you as always. And I just really wanted to start with what sparked your interest in fibromyalgia research?
That's such a great question. First and foremost, I just want to say thank you for having me here. It's an absolute pleasure to be on the show. I fangirl over both of you. And as I mentioned, we're like colleagues and friends at this point. It's just been a wonderful journey over these past few years. My journey to fibromyalgia research, I think, is a little convoluted, and that just comes from my training. So, anesthesiology was my original subspecialty. So I was like putting people to sleep in operating rooms, not really talking to people too much, right? We're like, hey, how are you? Like, I'm going to put you to sleep, like, good night. And then it's like, hey, wake up, like, okay, bye. It wasn't a whole lot of like follow-up, and that's really what drove me to pain medicine as a subspecialty fellowship after anesthesiology residency. Was I really found myself lacking that continuity, that ability to build those relationships. And then during my fellowship, most of our conditions that we treated in the Comprehensive Spine Center at UCLA were spine conditions, neuropathic pain conditions like CRPS, and we would get some fibromyalgia sprinkled in there. But it really wasn't the focus of my subspecialty training, but I always found myself very interested in fibromyalgia patients because it was definitely a little bit less cut and dry than a disc herniation and a radiculopathy, where I could be like, okay, cool. Like, I see this disc herniation. We're going to put you in physical therapy, maybe do an injection, and then they get better. And it's like, again, bye. Whereas with fibromyalgia, over time, I don't know whether it was as a function of my gender that I started seeing more and more fibromyalgia patients, but I wasn't the type of pain doctor that would kind of turn down those referrals, right? Like I was taking any and all patients, but the fibromyalgia patients I just really found so complex and challenging. And honestly, as I started to read more and more, I got into the works of like Clifford Wolff, who was a basic scientist and published some of those seminal papers on central sensitization, which is, underlies fibromyalgia in terms of part of its pathophysiology. I started really getting into the work of Dr. Dan Claw at the University of Michigan and his team at the Chronic Pain and Fatigue Research Center, where, those ideas of fibromyalgia and the diagnosis of fibromyalgia were taken much bigger, right? In terms of how having fibromyalgia impacts one's navigation through surgical procedures or other types of therapies. And so I would say once I got introduced to Dr. Dan Claw through a mutual colleague, that was really what changed my life, to be honest. I had left UCLA for the University of Kansas. This is where I'm from. You can take the girl out of Kansas, but you can't take the Kansas out of the girl. I was the mom of two small kids. I was just like, okay, I need to be where I'm comfortable. And I was really recruited to KU to develop a pain research program. I had no clue it was going to end up being about fibromyalgia at that time. And so through my initial discussions with Dr. Dan Claw, we started just like kind of riffing scientifically about anecdotally what I was seeing in the clinic, what my passions were surrounding patients with fibromyalgia, whether it's, meaningful movement research or interventional research. But I found really where I got very, motivated was understanding how fibromyalgia impacts other medical journeys that patients with fibromyalgia might have. So my very first grant that I submitted to the National Institutes of Health was a training grant. It's essentially a 5-year mechanism that allows you to have protected time. When you're a busy clinician, you're expected to be in clinic, but if you're in clinic all the time, you can't focus your time on research.
Yep.
So the National Institutes of Health and other, different organizations have these mentored career grant awards where you're able to have a certain amount of protected time. There's salary coverage and coverage for research that really gives you that opportunity to take your hypotheses and your area of interest and do the research. So that I did get awarded a grant after a couple of years. It takes a while at the NIH to get these grants, but essentially looking at this concept that fibromyalgia and fibromyalgianists can impact how one navigates spine surgery for the very first time. COVID impacted that. I was funded in 2018, which was right before COVID. And then during that time, spine surgeries weren't happening very much. So we actually are just now analyzing our data. Just now.
Okay. Well, science takes time.
That's right.
Exciting.
Yes.
But after I got that first award, it just kind of let me know in a larger sense that fibromyalgia research is doable as a career. And that there's a great paucity of it, and that, Dr. Dan Claw at the University of Michigan was there to mentor me, to kind of lead me to my next steps of becoming an independent investigator. And once I, was moving forward and I had his support and I had these grants and I had the support of my institution, that's when I founded the Fibromyalgia and Centralized Pain Exploration Lab, also known as the FACE Lab. We put a face to invisible illnesses as our little
love it.
I like it.
Yes, love it.
And that's the goal. Our goal is to do research, and we do mechanistic research, meaning we're looking at mechanisms of chronic pain. We do interventional-based research. I have some grants that aren't specifically about fibro, but have that idea of centralized pain as part of them. But ultimately, right now, we have 3 funded grants through the National Institutes of Health and many more in the pipeline.
Wow. Well, I just have to say, from the bottom of my heart as somebody with fibromyalgia, thank you so much for dedicating your career. Both you and Dr. Claw are so meaningful and important to everybody with fibromyalgia. And I just want to say, anybody that's watching, if you have fibromyalgia and feel like it's being neglected, there are people out there that are dedicating their entire career to studying it. And I think that in itself is so important for us to kind of remember. And then clinically, you have some treatment of fibromyalgia, and tell us about Swing Care. What's that?
Absolutely. I had this very serendipitous introduction to a company called Swing Therapeutics. And, they were really just looking to engage me as they were working to develop and get approved their digital therapeutic for fibromyalgia. And during those discussions, we really kind of realized that there's no medical home for fibromyalgia. And I mean, I know this, you guys know this, there's no one specialty or, clinics across the country where their main tagline is, hey, we treat fibromyalgia.
Everybody with fibromyalgia watching this is like, yes, we've had that problem. How do I find somebody?
Yeah. And then
There's going to be a lot of comments.
Right? I have patients who are like, yeah, I got a referral to rheumatology. They told me, oh, it's fibromyalgia. We don't see fibromyalgia.
Go back to your PCP.
Go back to your PCP. And I'm only one person, and I know Dr. Lipton, you're only one person, and geographically we're very far apart. And so it's one of those things where we can have these unicorn doctors across the country, but that limits access, right? I would say there's the vast majority of fibromyalgia patients can't access my clinic if they're living, 800 to 1,000 plus miles away.
Right.
And so
we're out of the country
we're out of the country. Exactly. And so Swing Care was really born out of this idea that, fibromyalgia is a condition. Yes, it would be optimal if we could see every patient in person for fibromyalgia. But when you really look at the underpinnings of fibromyalgia mechanistically, that hands-on exam, that tender point exam is not how we diagnose it at all anymore. And so to treat fibromyalgia, this virtual solution really is a possibility. And so we created Swing Care to be the first virtual fibromyalgia care clinic here in the United States. And we're now operating in 9+ states. And it's been a really exciting journey to have this grow the way that it did. And, we're just so excited about bringing the care to the masses, to people who just deserve it so much and are oftentimes, I think, overlooked by society when it comes to, being given access and the space and to compassionate care.
And we will put links in the description below to how to find Swing Care. And then maybe we can put the 9 states that you're currently active in. And I know your guys are trying to broaden that and I think ultimately go national. Is that kind of the goal?
Ultimately, we're still essentially kind of a startup company. We're growing and expanding and honestly navigating the landscape of just insurance and how things work. We're the United States, but each state has its own laws and limitations and policies. And so, as we expand, we have to make sure that we're crossing our T's and dotting our I's and making sure that the care that we can provide in those states is following all the policies and regulations set forth for medical care here in the United States. But yeah, it's very exciting. I think if you go to our website, there's a schematic or a little graphic that shows what states we're currently active in and what insurance plans we're currently contracted with. Yeah.
Perfect. And is that swingcare.com?
I believe so.
Okay.
I should know that.
We'll make sure we have it correct in the bottom there.
Either www.swing.care or www.swingcare.com.
Okay.
All of those.
We'll put it in the description. No worries.
Exactly.
I'm having a little fibro fog here myself.
It's a little contagious. Sorry. We're very sorry.
Through osmosis. I'm just.
So, we're so glad that you are in all of these states and that you're bringing that awareness. And I know that we're going to have viewers asking, well, what could I expect for treatment? If I went to Swing Care, and also that might inform some of our viewers who can't access you yet. Like what things do you recommend and what might some of our viewers, talk to their doctors about?
Absolutely. I would say we definitely follow a dogma of care that I know Ginevra and I share, which is multimodal fibromyalgia care. That's very much whole person focused. We obviously recommend medications if they're indicated and if a patient's wanting that type of therapy. We focus on non-opioid therapy, medications that are FDA approved, and off-label uses of medications such as low-dose naltrexone. So there is a whole variety of medications that our providers can use. But what we really feel is a selling point or what sets us apart in the Swing Care universe is that we have the ability to use additional therapies that are focused on behavioral interventions through a digital therapeutic that allows patients to do a form of cognitive behavioral therapy called acceptance and commitment therapy on their smartphones. And then that's very much embedded, if they are a candidate for that type of therapy, into their care and Swing Care, and oftentimes is done in parallel with medication management, one-on-ones with clinicians, whether it's a MD or a nurse practitioner. We've got a whole slate of people who've been expertly trained with our care guidelines and have expertise in managing these medications with some really cool and interesting backgrounds. We've got, nurse practitioners who've got integrative and wellness care. We've got our MDs have their own flavor of what they did in primary care and in internal medicine and general medicine. And they all bring those together to be able to provide expert care to patients. But that behavioral component is embedded in. It involves a lot of different touch points. There's coaching that's involved. We also have a pain psychologist on our staff who's able to give more in-depth behavioral wellness treatments to patients. And then we obviously focus on a variety of what, I would say would be more functional or integrative approaches, looking at movement, dietary interventions, nutraceuticals, including, different types of food as medicine, but also supplements, things like that. It's really that whole person approach that you have so expertly described in your 2 books, the Fibro Manual and the Fibro Food. I mean, those are things we recommend to our patients in our clinic as well. And, honestly, being able to educate patients about things like the Fibro Show. I mean, this all is so much larger than just medical care. It's about journeys with patients, partnering with them as they seek to live their values and live their best lives. And then that concept of community when it comes to fibromyalgia, and having patients feel seen and heard and validated, and have a space where they can feel safe to interact with peers that have fibromyalgia as well. So I just want to say kudos to what you've done here with the Fibro Show and how that gives access to community for patients, as well as your other platforms for community. You guys are just amazing.
Thank you so much.
Yeah, we appreciate that.
I asked, where is the Swing Care therapeutic app something people can access outside of getting care with Swing Care Clinic, or is it only as part of that? Because I know people are going to want to know.
For the most part, it's embedded within our clinic.
Okay.
Yeah.
Got it. Maybe down the road, it'll be something.
I think so, yes.
Okay. What research are you working on right now that involves fibromyalgia and chronic pain? You said you had three.
I have 3 studies. Three funded grants. 2 of them are really more centralized pain focused, focused on, improving outcomes after spine surgery. That's one of them, where we're using motivational interviewing to help people as they heal from spine surgery be able to reduce their opioid usage, and understanding how opioids can contribute to centralized pain in some people.
Yeah.
So that's a study that we just launched and we're really excited about. Another study is looking at how peripheral nerve stimulators, this one's a really science-y grant. This one's trying to understand how these implants on peripheral nerves can actually change the functioning of the nerve, and identifying how these devices work. A lot of my colleagues implant these devices, which can really change people's lives. Generally speaking, they're not meant for the treatment of fibromyalgia. But we do know that those same type of central sensitization problems happen in any chronic pain patient. So my focus on that grant is really looking at using a form of testing called quantitative sensory testing. It's one of my areas of research expertise, to understand how, using these different tools, we can assess the functioning of the nervous system for pain, and identifying, if certain patterns exist that predict benefit from these types of implants. So that one's a little bit different than fibromyalgia research. But again, they all have this under theme of central sensitization and centralized pain. And then the grant that we were most recently funded with by the NIH is looking at the development of nociplastic pain or centralized pain syndromes in our gender minority patients. And so these are patients who are considered gender diverse or transgender. We are monitoring how their pain may change as they take gender affirming hormone therapy. And so what we know is there's a delicate interplay between sex hormones and the development of pain. There are patients with fibromyalgia who develop it with menopause. So we know that there are these hormonal changes that can lead to the development of pain, the maintenance of pain, the chronification of pain, but really trying to understand. We published a study last year showing that in gender minority and transgender patients that there's very high levels of widespread pain and chronic pain in patients who identify as gender minorities. And so we're talking, upwards of 40 to 50% of the entire cohort has chronic pain. So this is very much larger than just the general population. And so understanding, why do patients who are gender minorities or identify as transgender have these higher levels of fibromyalgia and chronic pain? And feel very lucky to have received that grant. And I think this is a population that very much needs this research. But those are our 3 current grants.
Cool.
But we also just published the hot tub study.
Woo!
Yay! So that, as you know, I've been speaking about for years. This was another COVID project where we put people in a hot tub and called it research. But,
Can I sign up for that research?
right?
Yeah.
I mean, it's pretty awesome. But ultimately, we found that 4 weeks of heat therapy, so submersing themselves in a hot tub 3 times a week for 45 minutes for a whole month, that we had in 8 patients statistically significant improvements in their pain, their physical functioning, decreases in their sleep-related impairment. And it also had kind of a nerdy science component where we showed that like heat shock proteins that are released when you get exposed to heat were either upregulated and downregulated, and how that specific heat shock protein is involved in inflammation, or how this heat shock protein is involved in opioid receptor activity. So that I'm very excited that we're going to be submitting for another larger grant to be able to do that on a bigger scale. So
Very cool.
that one will be fibromyalgia focused. I've got a couple others in the pipeline looking at skin changes, skin nerve density changes. You may have heard of like small fiber neuropathy.
Yeah.
So we have some preliminary data showing that chronic pain patients, even though not diagnosable with small fiber neuropathy, have lower levels of nerve fiber density compared to healthy controls. And so we're just, I got my hand in a lot of different pots when it comes to research, but that's how I like it, because if you look at chronic pain and you look at central sensitization and we all have the potential to be on that spectrum of fibromyalgia, right? And it underlies almost every chronic pain condition. And so to spread out and be like, I'm going to look at this and this and this and this and this, it's all meaningful, because it's still kind of all fibromyalgia research.
It's all connected.
Yes, all connected, either directly or somewhat indirectly, in the fact that often with fibromyalgia, we have these overlapping chronic pain conditions, which include some of the things that you're talking about here.
Totally.
So,
or need to have spine surgery, or et cetera. Yeah.
You don't just live in a vacuum when you have fibromyalgia. There's, it can exist with anything. And so I think it is important to look at these different conditions outside of fibromyalgia, but having that fibromyalgia focus part of it really helps us understand how a person with fibromyalgia may experience that journey differently than someone who doesn't have fibromyalgia. And like, what can we do to make sure that journey is as stable as possible?
And I love that you're doing that, because I know, like, when I have surgeries and things, you always know, as someone with fibromyalgia, like, okay, how is this going to be impacted? How can I reduce some of that impact? And having data like this and plans in place when you go into a surgery gives you a higher level of comfort. Absolutely. And reduces some of that anxiety that, of course, is going to be there when you do something like that.
Yep. Well, as a parent of a trans kid, I just want to say thank you so much for doing that research. And it's weird days right now with that. And I'm kind of wondering, have you experienced any effects from kind of the tumultuous past few months at the NIH with kind of funding being thrown up in the air a little bit?
Well, as of right now, I have received no stop work orders. So for us, it's business as usual. I have no idea what fate may come for my grant, but I'm proud to announce that we've launched the study, and I'm going to recruit as many people as I can, and hopefully be able to continue it with some internal support from people who know what this research means, not only to me, but to the larger community of people in the LGBTQ community. So I will say that these are crazy time, unprecedented times. I remain hopeful that science will remain politics free.
As it should be. Yeah.
And that the pursuit of facts and knowledge to help not only the people of the United States, but the research we do here has global impact. I very much hope that the unprecedented times that we are in will hopefully calm down, that we'll have calmer waters ahead. But, we're all just kind of
one day at a time.
It is honestly just one day at a time. Yep. And I don't lose focus, that what I do is meaningful. And, if they end up canceling my grant, that's, you can take my grant, but you can't take my science. That's how I feel about it. And I'm going to continue to do the work that needs to be done, because people with fibromyalgia have all different gender identities, all different sexes, different sexual orientations. I mean, anyone can get fibromyalgia, really. So the research needs to be done, and I'm going to continue to do it.
Thank you. Not to mention that there is learning there outside of, or not outside of, but that applies to all sexes. Like, there's going to be meaningful information that you learn from that will have an impact on every sex.
Absolutely.
Everyone has hormones. Like, we all have hormones. So.
Absolutely. Yeah. And, I always tell my patients to be resilient, to have that hope, to not be knocked down when, or let yourself remain knocked down when you are knocked down, right? I have to live that myself. I can't let myself be sad, ordering chicken tenders and eating bonbons, every single day, crying about how horrible whatever is. Like, no, I'm going to get up and I'm going to do the good work. And for me, that's how I can move on feeling hopeful.
Yeah, and you got to keep that hope alive. And speaking of hope, if there was this magic universe that happened and magically funding was suddenly unlimited, what research project would be your dream fibro research project, and why?
Oh my gosh,
would it be hot tubs for everyone?
Hot tubs for everyone.
Covered by insurance.
Yes, absolutely. I mean, I will say that study has my heart, because I developed it with a basic scientist who literally was studying like animals, like little rats that she put in hot baths. And I remember being like, oh, my patients like hot tubs. And I walked up to her, I was like, hey, I have a crazy idea. Let's do this study. I mean, that's what's so fun about this, is I really feel like the possibilities are endless. I mean, I would love to do some research. I have a colleague who looks at how music can affect pain. And, we just actually finished a questionnaire study looking at how fibromyalgia patients use music to help with their pain. So I would love to look at a music intervention study, maybe Lady Gaga. That would be super cool if she wanted to be involved. I think we need better treatments. We need better treatments. I think we need new drug discoveries. I'm not a biochemist. I'm not someone who can develop molecules, but we need those people to keep getting funded at the basic science level to develop molecules that may help fibromyalgia patients. We need the good research that shows that these behavioral interventions, that these hot tub interventions, that XYZ interventions work excellently for fibromyalgia patients, because the hope is one day that these things that are, maybe cost prohibitive for people, if we have enough good research, policy might cover them. I mean, that's where a lot of this leads me is, so many patients tell me that, I've heard that this is helpful, and I'll say, yes, the research has shown that, but it's too expensive.
That's where
it's not covered by insurance.
If I had magical research funding unicorns that were raining money down upon me, I would want to study more about myofascial release, because that personally is a therapy that I found so effective, and there is data supporting it, but you can't get insurance to pay for it. So it's I would just want to spend millions of dollars trying to show without, so insurance had to pay for it, but alas, until the unicorn funding occurs.
Unicorn money rain.
Yeah,
We
exactly.
can dream here on the Fibro Show.
That's what
We do.
happens on
We
the
like to
Fibro
dream.
Show. We
That's
love
right.
We're so glad that you joined us on the Fibro Show. You were our first guest, and you have set the bar really high. So we both just adore you and the work that you're doing.
the feeling is mutual.
And for everybody watching, don't miss the 24th Annual Fibromyalgia Awareness Day Conference. It's happening on May 10th from 2 to 4 p.m. Eastern Time, live on Zoom. It's going to be an informative, inspiring event featuring 2 experts in the field of fibromyalgia. One of your mentors, Dr. Daniel Klaw, renowned fibromyalgia researcher, director of the Chronic Pain and Fatigue Research Center at the University of Michigan, will be there. And the Fibro Show's own Dr. Ginevra Lipton will be there.
Yeah, so the event is probably sponsored by Tonix Pharmaceuticals and is a must attend for everyone affected by fibromyalgia. Registration is now open at managefibro.org. That's managefibro.org. And all the details and more, including how to reserve your spot, are there. By buying a ticket, you're actually helping us at the Fibromyalgia Association and here as a Awareness Day partner to get more outreach out there about fibromyalgia and Awareness Day. And I'm getting a little tongue-tied here. So please support Fibromyalgia Awareness Day and keep the comments coming. We love knowing how the show is helping you, what your important takeaways are, and any questions that you might have. And please like, subscribe, and ring the bell. Then you'll never miss an episode of the show. So again, thank you so much for being here, Andrea. You are welcome anytime on the Fibro Show. We'd love to have you back when you get more research and so on.
For you too.
We're sending you Fibro love, everyone, and to you, Dr. Chadwick. Thank you so much.